So briefly, we'll be looking at how we can be able to use sympatholytic substances or sympatholytic drugs, okay, to be able to treat or manage hypertensive cases. All right, that's basically their action, their anti-hypertensive action. Okay, so we'll discuss mechanism of anti-hypertensive effect of what sympatholytic drugs. Okay, so this mechanism of action needs to be brief because it's just straightforward. First of all, we have a definition of what sympatholytic agents or sympatholytic drugs are. I would say that sympatholytic agents inhibit the activity of the sympathetic system. That's the sympathetic nervous system that tends to actually what activate the body for fight, fright, and flight. Okay, so this sympatholytic agent they will inhibit the sympathetic system, right? And the sympathetic system, you remember, is mediated by what the epinephrine and the norepinephrine. All right. So these sympatholytic agents they reduce blood pressure mainly by stimulating central adrenergic receptors in the what brainstem, right? And these adrenergic receptors were receptors that the norepinephrine and the epinephrine will come to bind, right? So the sympatholytic agents will come to bind to the receptors that this norepinephrine and epinephrine are supposed to bind, right? Thereby inhibiting the epinephrine and norepinephrine from binding, all right? So now thereby they reduce sympathetic nerve activity and neuronal release of what norepinephrine to the heart and peripheral circulation, right? Because they occupy where the norepinephrine and epinephrine is supposed to actually occupy, all right? Those are the sympatholytic agents. You see them? Sympatholytic agent, central, all right? They basically block, all right? Adrenergic neuron blockers, right? They block. Why we say they block is because they are occupying where another thing is supposed to actually occupy, okay? So examples of these agents, we have methyl dopa, also known as what? Alpha methyl 3,4-dihydroL-phenylalanine, okay? Is a centrally acting antihypertensive agent that exerts its effect via an active metabolite, okay? Then this alpha methyl 3,4-dihydroL-phenylalanine is actually an analog of a 3,4-diphenylalanine, alanine, okay, that's dopa, okay. It is metabolized into alpha methyl norepinephrine, okay, via methyl dopamine, which substitutes what norepinephrine in neurosecretory vesicles, right? So these substances, how they act is they actually look like the main stuffs, right? Okay, the sympatholytic substances, they look like the sympathetic neurotransmitters. Do you understand? So the sympathetic receptors now will now accept these substances that look like the sympathetic neurotransmitters, not knowing that these substances have an opposing function. Okay, so this was just the example there. Now, because the false neurotransmitter is as potent as what norepinephrine, okay, its substitution for norepinephrine does not alter the vasoconstrictor response to the peripheral adrenergic what neurotransmission, okay. So alpha methyl norepinephrine acts centrally in the brain to inhibit adrenergic neuronal outflow from the brainstem, and this central effect is principally what responsible for its anti-hypertensive action. All right. So they basically trick the receptors for the receptors to feel like, okay, we are the sympathetic neurotransmitters, right? But when the receptors accept them now, they now act in the opposite way. Okay. So this is basically antihypertensive what or mechanism of antihypertensive effect of what sympatholytics in the body. All right. So that's it, and see you guys pretty soon.